Now that you are able to identify a problem for a patient in a wider scope and keep that wider scope throughout the design process, you can make a well-prepared start for innovative product and service design in healthcare. In this course, we focus on patients that were in need of a specific surgical procedure. But of course, this method is not restricted to that. You also experienced that already in the interviews you did with your teammates. In fact, you can make patient journeys of all kinds of procedures, as well in the hospital as in outpatient procedures. We can make patient journeys of elderly in care homes, of young patients with cancer, patients that have chronic diseases like diabetes. We can also extend the journey to other actors in the process, like surgeons, nurses, and other healthcare professionals. We can even think of product journeys in healthcare. Here are some examples. Patients with a metabolic disorder have high levels of cholesterol and they need support in making decisions. A consultation experience journey was made, and this led to a communication tool that covers the critical elements in decision making. A second example. Patients in the emergency room of an academic hospital have a lot of stress about what is upcoming. The patient experience journey helped to identify 4 main areas of concern, and an application was designed to show to the patient the steps in the process and the timeline. And a final example. Young babies are born in need for intravenous medication. A product journey showed the critical points in the different stages of the product use. These points were used for the design of a new IV set. What all the journeys have in common is that they take place in the domain of healthcare. And that domain needs a holistic approach because of the interdependencies of so many actors. And the method that was presented in this course offers just that.